So going to the next slide, we're going to talk briefly about some potential postpartum discomforts that you can have. And there are physical as well as emotional discomforts in that postpartum period. Understand that after birth, you're going to continue to have contractions. We call them after birth contractions. So if you need to, use your relaxation techniques you've practiced or request analgesics as needed. Women will have an inability to urinate after birth. So we always want to make sure that you're drinking plenty of fluids. It may help to run some water in the sink while you're trying to urinate in the bathroom. You might even pour warm water over the perineum, and you'll typically find in your birthing center that they will have some kind of a squirt bottle you can fill with warm water, and it also helps to clean the perineum. And if you're having issues, make sure that your healthcare team knows, and they can offer some other ways to help alleviate and help you get that first urination in. The first bowel movement can also be somewhat difficult, so you may want to have a stool softener. Again, drink lots of fluids. You want to eat foods high in bulk with a lot of grains. And you may need a suppository, some kind of a laxative, or sometimes women even need an enema. But make sure you've had a bowel movement before you leave the hospital or birthing center. Hemorrhoids can be another physical discomfort in the postpartum time. Some women had them before they got pregnant, and others developed them during pregnancy or even during labor and birth. You can apply topical anesthetics, use Tux pads. They have an anesthetic within them too. And if needed, you want to discuss other medications with your healthcare provider. You might have pain from the repair of an episiotomy, or even if you had a little bit of tearing. Again, the ice pack's very helpful for the first 24 hours. After that, we might help or suggest you take a warm sitz bath. And it's called a sitz bath because you're sitting and the water's continually running in and draining out. And you could take a short tub bath at home if that's helpful, but you don't want to spend a long time lounging in a bath when you've just delivered and you've got a fair amount of lochia or vaginal blood flow. It just might increase the risk of infections. So short tub baths, and I suggest you have the water running and also draining at the same time. You can apply topical anesthetics. They come in sprays or foams. And again, you can use Tux pads also on that episiotomy. You are probably going to be given a prescription for some kind of an analgesic, and I would suggest if you're in that much discomfort, take those analgesics. It will help you to have a quicker recovery those first few days. You may also notice postpartum that you have some breast discomfort, particularly on about the third or fourth day when the milk comes in. So ensure that the baby is latching on properly, that they're getting the entire areola, or that brown part of the nipple. They're getting that entire part in their mouth rather than just the nipple. You could also ensure that you're wearing a supportive bra. And if you're breastfeeding, you can take a nice warm shower. That may help some of that milk fluid to drip out and relieve some of the pressure of the full breast. If you're still really uncomfortable between feedings, you could apply a cold compress to the breast between feedings. If you're continuing to have problems with breast discomfort, or you're noticing sores or cracks or things occurring around the nipple area, contact a lactation consultant. Again, they are very well trained and know how to help you get through this first period of breastfeeding and all the discomforts that can come with breastfeeding. So on to the next slide, we will talk here about emotional changes that are happening to you postpartum. The postpartum blues, also sometimes called the baby blues, these are a common experience for many women. Most women experience some degree of depression or blues following the birth of a child. And this is fairly normal with the way the hormones are all changing rapidly in your body. The blues are probably a combination of many factors, but that includes the hormonal changes, physical discomforts, fatigue from being up and caring for the new baby. And maybe there's even disappointment at not immediately regaining your pre-pregnant shape. Some women have anxiety about assuming total responsibility for this infant. Or maybe it's even adjustment to the loneliness of staying home after you've been working for years. Or maybe you're worrying about having to return to work, and you're balancing the needs of this new infant with those of all the other family members. There's a lot of things happening and going on emotionally after the birth of your baby. So the most important thing to remember about this period is that it is normal to have some negative or blue feelings from time to time. If you truly feel depressed and those feelings persist or intensify, or if you're unable to properly care for your baby or care for yourself, seek help from your healthcare provider immediately. Postpartum blues are normal, but postpartum depression is a state that is more complicated and may require help from your healthcare team. So usually by about 6 to 8 weeks postpartum, you will have regained your strength, your baby will have settled into some sort of a schedule, and your family will have developed some new routines to accommodate the needs of this new baby. And those postpartum blues should really have subsided. So lastly, we're going to talk about resuming your sexual relationship in that postpartum period. So like pregnancy, the postpartum period can be a stressful time in a couple's sexual relationship. So recognize that your intimate relationship with your partner and your love for each other will not be changed by your new role as parents. A couple may be apprehensive that intercourse, that first intercourse after childbirth, will be painful. Now, I'm not saying it will be, but it could be somewhat uncomfortable. If you've had an episiotomy, you may have some additional fear of pain at that incision site. And in addition, the needs of the baby are physically demanding, and you and your partner, you could be experiencing some pretty extreme fatigue. So bearing in mind all of these factors, it's also true that this is one of the times in your relationship when a satisfying sex life can most benefit this relationship. So recognize that your intimate relationship and your love for each other can get you through this time in learning how to resume that sexual relationship again. And some suggestions include: 1, ensure that the episiotomy has repaired sufficiently. This usually takes about 4 to 6 weeks, so ensure that it's repaired prior to vaginal intercourse. Most women find that the initial intercourse after birth is most comfortable when the woman is on top of the man. This simply allows you to control the level of penetration and decreases the discomfort you may feel at that incision site if you've had an episiotomy. Would suggest also that you use some kind of a vaginal lubricant. This will help ease the penile penetration and lessen the discomfort. Consider talking this out with your partner and setting aside a time for sexual relations when someone else has the baby, or when the baby's just been fed and put down, and while the baby's sleeping. So know that together you and your partner can work through this, but it really requires communication and patience and a love for each other, and knowing how to talk to each other about what's happening as you're resuming your sexual relationship. With that, that is the end of week 4, and I wish you all a happy, healthy labor and delivery and enjoyment at the birth of your new baby. And congratulations on this new family that is coming into your life.